My name is Adrian Froggatt, and I'm Governor of Rotary District 9820 in Victoria. It is my district's pleasure to bring you tonight's webinar featuring Federal Health Minister, the Honourable Greg Hunt. A warm welcome to my Australian District Governor colleagues and to the many Rotarians and interested members of the public from across Australia and beyond. With over 570 registrations, we have participants from all our states and territories. And I would especially like to make welcome Paul, who's joined us all the way from Tel Aviv in Israel. District 9820 runs from Mornington Peninsula through Gippsland to the New South Wales border in Victoria. Like so many parts of the country, we've been hammered by drought, bushfires, and now the COVID-19 pandemic. The communities we serve have been hit very hard in the last year. Tonight, we're focusing on COVID-19 and welcome one of the leaders of Australia's COVID-19 response, the Federal Health Minister, the Honourable Greg Hunt, MP, Federal Member for Flinders. Minister Hunt has had a long association with Rotary and is a Rotarian himself. His electorate of Flinders falls within District 9820. Tonight, he is joined in his office with the required social distancing, I might add, by President Peter Rawlings, Mount Martha, Rotary, and our District Governor-elect, Mark Humphreys of the Mount Eliza Club. Peter will be managing the questions and Mark is our moderator and technical specialist. Please join me in welcoming Minister Hunt as we switch from my home in beautiful Lochsport on the Gippsland Lakes to the Minister's office in Somerville.
Rawlings, who's a safe 1.5 metres away. To everybody in Rotary, thank you for what you're doing for the country. I know this is a really challenging, unprecedented time. The good news is that what we're able to do is bring down the rate of infection in Australia. And I'll just explain to you briefly the strategy and the progress. The strategy is knowing that had we done nothing, we would have faced potentially between 3 and 20 million Australians who could have contracted the disease, and with a fatality rate of about 1%, you can imagine the human tragedy involved. Even when we look overseas in New York and London and in Milan and Barcelona, and we see that absolute tragedy now, what's not necessarily understood is those cities are locked down to the point where Barcelona and Milan are under 3% of their normal transport movement. New York and San Francisco are under 5%. And so the restrictions there are far, far greater than in Australia, even though the case numbers are dramatically higher. And the point of all of that is the early action and the strategy has meant a massive program of saving lives and protecting lives in Australia. So we have two parts: containment, which is about reducing the rate of infection on a daily basis. That is literally the flattening the curve strategy, and capacity, which is about increasing what we're doing to ensure that our primary care, which is our doctors and nurses, and our aged care, coupled with our hospitals, are in a strong position. 4 pillars to what we're doing with our containment. Firstly, the ring of steel around the borders, preventing foreign nationals coming in, and I know it's difficult, but everybody coming into Australia as Australian citizens going into quarantine. This has been fundamental in preventing the spread. One of the broadest testing regimes in the world. We have one of the highest rates of testing and one of the lowest positive rates and one of the lowest death rates against identified cases. What does that mean? It means that we're actually testing very broadly and picking up the overwhelming majority of cases in the community. The iron indicator, unfortunately, is the loss of life. You could multiply that by 100 and you're likely to get the real case rate in a country. The next thing is we have the tracing, where we find somebody who does test positive, following through to prevent the spread, to isolate those people. That's been one of the most important things that this country and any country can do. And then finally, the distancing and self-isolation requirements. They're the things that have built the Australian response. Flip side has been in primary care, to protect our doctors and to protect our patients through telehealth. Still, the face-to-face is there if you need it, and we want you to go wherever you have a cardiac or a cancer or a blood pressure issue and you need to be face-to-face with the doctor. But we've had now well over 3.5 million telehealth consultations. What was going to be a 10-year process became a 10-day process. So we might have something permanent that comes out of this. The aged care sector has had remarkably few infections. It's the area that I'm most worried about, but we've really worked together with them to keep that tightly locked down. And then the hospitals, we're going from 2,200 ventilator capacity to 7,500, but we're now well within that in terms of our safety margin, so deeply within that. Just before coming to air, the latest figure I had was 80 cases in ICU and just over 40 cases on ventilators around the country. So they're very positive. Now we're planning the way out, and what we're looking at are really three things. One, to get those case numbers really down, because we can still have spikes as we've seen in northern Tasmania. So case numbers down, retransmission rates down on a sustained basis. Secondly, to have a really strong rapid response capability, and that is expanded testing again, and that's just started. New South Wales, Victoria, WA have all announced programs and others are doing it. Two is to have enhanced tracing capabilities. We're doing really well, but where we find a case, to have the human resources, to have the capability of finding out whom you've been in contact with. And then we're even looking at things such as early identification through sewage testing. It sounds a little unglamorous, but we do that at the moment to understand drug use in the population. So we're actually testing on a daily basis, and we're now considering that as a possibility. And then that allows us to start with the highest value, lowest health risk actions to gradually step our way out. Now that's still some weeks away, you know, PM did today many weeks, but I've just been spending the afternoon with him and other ministers and planning that pathway through. And so we're looking at get those two prerequisites in place, really low sustained case numbers and very strong rapid deployment, and then that will allow us to take steps out, in particular things such as schools and elective surgery first, other activities which follow that. The borders are likely to be the last thing, because it's going to be a very scary world out there. Some very difficult situations, and I've said this publicly before, there's nothing new in that, but some countries are facing a very heart-rending challenge going forward, and that means that it may take a little while before we're able to open the borders. So that's a quick summary, but all up, I think I'd rather be in Australia than virtually anywhere else in the world, and I've said that in other times, but I think that's even more so now. But I know many of you are doing it tough, which is why mental health has been a huge part of what we're doing. Beyond Blue, Lifeline, support for the work of Headspace for younger people, and the $74 million package, but it's not the money, it's that support, whilst we give people real hope that we're going to avoid the just agonising scenes we've seen overseas, and that there's a way through this on a realistic time frame. Over to you. Happy to take questions.
Well, thank you, Minister, for those words. Now, we've received many questions over the past week as we've prepared for tonight, and I just want to thank all of those who've submitted questions through to us. We will attempt to answer as many of those as possible this evening, and you can also send through live questions using the Q&A facility, which you'll either see at the top or the bottom of your screen. So, Greg, our first question comes from our District Governor, Adrian, who just introduced himself earlier. The statement first and then the question. Minister, as I'm sure that you are aware, Rotary has been leading the global fight to eradicate the polio virus since the late 1980s. Along with our partners, we have built up infrastructure and assets experienced in mass delivery of vaccines. You may not be aware, but the Polio Oversight Board has recently agreed that for the next 4 to 6 months, programmatic and operational assets and human resources from global to country level will be made available to enable a strong response to COVID-19. This includes emergency operations centres, physical assets such as transportation or IT hardware, and our frontline worker networks in many countries. Internationally, Rotary and its polio partners are standing by to assist the fast delivery of the yet to be discovered and released vaccine. So the question from District Governor Adrian, given the known capabilities of Rotarians globally and here in Australia, as demonstrated in the aftermath of this year's droughts, fires and floods, what role do you see for the Rotary districts of Australia in the national recovery from COVID-19 pandemic and its associated health, social and economic impacts?
Great. And look, thanks very much, Adrian, and to everybody in Rotary. Firstly, for what you've done with regards to polio, you have literally made that difference along with others, which has removed overwhelmingly, I think we're almost there globally, a terrible threat. Now, those same resources, that same energy can make a huge difference here. Honest answer, there's no vaccine yet, but there are 70 under investigation and development with some lead candidates. I've spoken with the global head of CSL, the global head of vaccines for Johnson & Johnson, only yesterday with the head of the Doherty Institute here at Melbourne University, one of the world's leading virology institutes. And so there are some promising candidates. We may or may not get there on a vaccine, but when we do, Rotary's network will be indispensable, not just in Australia, but especially around the world, in the developing countries. It will be such a fundamental part of the response. At the same time, we're working on over 70 different possible preventions, treatments, or vaccines here in Australia. There are multiple different assessments that are going ahead, and as a consequence of that, there are proposals which are already in clinical trial. The Walter and Eliza Hall Institute, the University of Queensland, there's a trial with health workers in WA, repurposed tuberculosis drug. We've got repurposed malarials, we've got antivirals, all of which are being tested at the moment, firstly for safety, and if they've been used in humans before, then there's a strong presumption, but secondly for effectiveness. And so clinical trials are funded, supported and being prepared as we speak. And so I am hopeful that we will certainly find improved ways to treat people and potentially to help with prevention. It's not a vaccine, but it's one step down and can help people resist and mitigate any onset and then help with treatment. So Rotary can play a huge role in all of those. The other thing that Rotary can do is there are many, many isolated seniors at the moment. And whether it's food or whether it's human contact, making those phone calls, maybe taking them to the doctor if they're not able to drive, helping them with their shopping, then that's just an immensely important part of health and mental health at this time.
Minister, our next question comes from another Adrian from Sale here in Victoria. A number of cruise ships located in Australian waters have been ordered to leave because of the risks their passengers and crew present to Australian communities. As these ships are unlikely to serve as cruise ships in the near future, can their owners be asked to allow them to remain so that they can be used as offshore quarantine stations for people suspected of being infected and hospital ships for treatment of COVID-19 patients?
Yeah, look, that's a very important question. I value that. Thank you, Adrian. We've come down from well over 20 ships in our waters to 3, and that's been an enormous achievement. And we've made sure that Australian passengers have disembarked, and where you have foreign flagged cruise ships, the goal is for them to return home. The experience of the Diamond Princess in Japan has been that as a quarantine, it tends not to be very effective. We have a duty to take care of people, as we did with the Artania off Western Australia, where there were foreign nationals that we brought into Australia. That's the same generosity that's been accorded to Australian citizens overseas in the vast majority of cases. But as a general rule, we're well supported on our hospitals and we have the capacity. And I think these last 3 ships are all due to leave, 2 of them this week. One of them is currently under an order, but it has a court case. We'll see how that goes. I won't preempt that. So 2 are due to leave this week. The third one is currently under an order, and at that point we'd be down from over 20 to 0.
Minister, our next question comes from Harry and Jim, both from Mount Eliza here in Victoria. And they asked about their inability to participate in certain leisure activities, such as fishing and golf, and the impact on mental well-being and general health, understanding that these restrictions are being applied at a state-by-state level.
Yeah, look, thanks to Harry and to Jim. I really understand this point. One of the things that the National Cabinet and the federal government has been focused on is making sure that our concern is about the behaviours, the distancing and the isolation. And at that point, we have set those rules in place and then individual states have interpreted them. There's generally been consistency across them. Victoria has taken, and there's no criticism here at all, just a factual observation, a slightly different view with regards to golf and to fishing. And I won't preempt them. I'll leave it to them as to the steps that they take. Our focus at a national level has been to, in particular, make sure that people are observing the social distancing rules, and they have done that magnificently. So we've left that to individual states. And I will say this, overwhelmingly, the states have done a great job and Victoria has done a great job. So we've come together, but I recognise that there will be some things at individual state levels that might prove to be a frustration.
And Minister, our next question comes from Canterbury, from Shirley and Dawn, with our peak chaplaincy body here in Victoria, Chorus Connect. It's a 3-part question. What collaborative measures is the government considering enabling communities to be preserved in the current context and to rebuild, recover and revitalise post-COVID-19? That's the first part. The second part, in a time of isolation, how can not-for-profit and volunteer organisations operate to help with current preservation efforts? And Minister, the third part, what can these organisations be doing now to position and prepare themselves for post-COVID-19? So we're talking about government collaborative measures. What can we do now? And what can these organisations do to position themselves post-COVID-19?
So the first thing is exactly what you're doing. You're connecting Rotarians around Australia through a program such as this, but to use all of your human and electronic resources, where you're able to set up connections to bring as many people into a social environment. Whilst there is physical social distancing, that doesn't mean there has to be actual social distancing. We've put out an additional $100 million to support community groups in their engagement with isolated seniors and isolated Australians. You might have people with disabilities, might have others, so to assist with Meals on Wheels. So there's the combination of the social work through the electronic means, exactly what we're doing here, but then there is the physical work of the Meals on Wheels, the taking isolated people to the doctor or to shopping if they can't do it for themselves but do want to go out. They're all seen as essential functions and perfectly appropriate. And you're already doing that, but I continue to do that. Then we've got the question of the broader role of volunteer groups. So volunteer groups where, for example, you might be running an op shop or other things, they can qualify for JobKeeper with a 15% reduction, which if you have employed staff, if you had a 15% reduction in income, then JobKeeper can apply, and that can assist people to continue on with their work. And then the third thing is, each organisation I'd encourage to plan for the future. We're encouraging people around the country. We're doing it, and we think the more you can do it, it's both hope, but it's realistic hope. And it's going to be a different world, as I've said. It may take a while before our borders are open. That's not new. That's something that all of us who are involved in this have observed. And so it might be a while before we can have visitors in or travellers out. And that's a different Australia. That's more of an island Australia, even though, you know, we've historically had that great natural advantage. It's been a massive defence mechanism in this challenge, but it will still mean that we will be operating as an island economy other than our exports as we go forwards, and that, I think, is a very important thing to take into account.
Thank you, Minister. We now head to northeastern New South Wales, to Gunnedah. A question from Mark. The volunteers, and you've partly covered that this question in your last answer. Are volunteers allowed to work on ground in a project, provided they observe social distancing and hygiene protocols? Does it make a difference if the project is significant to the community, for example, helping to construct a women's shelter, or, as you mentioned earlier, Meals on Wheels, compared to a park beautification project?
Yeah, sure. So subject to the social distancing rules, work is considered to be essential. And around the country, what we've done is create a negative list of things that can't be carried on. And that's included, in particular, the social gathering actions around retail and, in particular, hospitality. And I am very sorry and apologetic around that, but it's been literally saving lives and preventing the massive outbreak that we would have faced, and instead giving us the flattening of the curve down. So on any of these issues, if in doubt, just check with your local police station. As a general principle, if it's work, then it's primarily allowed unless it falls into one of the prohibited activities. On the volunteer basis, if it were seen as essential, then it could continue, and I'm sure a women's shelter, Meals on Wheels, support for the homeless, anything such as that. If it were something which was very discretionary at this time, then I think I'd strongly encourage you to talk with your local police to make sure that they are in agreement.
Our next question comes from Chris here in Mount Eliza, Victoria. As an orthopaedic consultant who travels into New South Wales, am I still able to, or is it wise to, continue to travel interstate to provide clinic consultations?
So interstate travel is allowed, but most states have closed their borders. Victoria, New South Wales and the ACT have not closed their border, but again, it would have to be for essential services. Provision of medical services is absolutely within that, and there are limited flights, and that is one of the challenges, but there are, as I say, still flights, and you are entitled. You would not be allowed to travel across some state borders, or in some cases you would have a 14-day quarantine period if you started to travel to Tasmania, South Australia, or or Queensland. You would only be allowed into WA if there was a specific exemption for you because you were deemed to be essential. So between Victoria and New South Wales, yes, but if it's a genuine work purpose, which is deemed to be essential.
Minister, our next question, I'll bring two questions into the one. The first one from Isabel from Berwick here in Victoria. As a retired ICU nurse, She applauds the increase in ventilators and ICU beds. She asks what is being done to train people in the use of this highly specialised equipment and critically ill patients. And the second question, which will tie in, is from Janet from Frankston here in Victoria. She expresses her concern with the current plans to upskill registered nurses with only limited hours of training, which could result in critically ill patients, she notes, dying from medical errors and not necessarily from the coronavirus. How do you propose to ensure that the public understands that the usually high-risk environment of an ICU could now see an even higher risk?
Yeah, look, I think these are very important questions. So to Isabel and Janet, thank you. To Isabel, who has been an ICU nurse, and Janet, I suspect, probably has a nursing background. And if she's from Frankston, my mother served at Frankston Hospital. In fact, that's where my parents met. So the answer here is that there are 20,000 nurses going through an upskilling program to assist within ICUs. Now, as things progress and as we flatten the curve, it's looking increasingly like we have the capacity we already need, but we are preparing for a second wave, as well as having prepared for and largely made very good progress on the first wave. Now, we're not expecting a second wave, but around the world, the history of epidemics and pandemics has been a very significant second wave. We've seen in Singapore and Korea and Japan, even though you would call it a minor increase, nevertheless an increase, and they've had to take increasing restrictions. So we're preparing for all contingencies. These nurses are being trained to the highest standard, but to assist in, not to operate and lead as the key people in an ICU. And so we have our existing doctors, we have our existing magnificent ICU nurses, but even at Frankston Hospital, the head of the hospital took me through recently what she and her team were doing, and they were bringing other highly skilled nurses up to ICU training capacity, but they would then work under existing doctors, existing nurses, and people such as the anaesthetists who are skilled at using breathing apparatus in their day job are, as a very large group, looking at coming across and being the next group of doctors to assist with upskill training and just transferring slightly their skills to ICU.
We now head back to the Central Coast, to Taree in New South Wales. A question from Grace. Grace is a GP, a rural generalist doctor, and she asks, how can we reach out to our third world neighbours, both as a government and as Rotarians, through overseas aid projects during and after this time of crisis?
Yeah, look, this is a very important question. Obviously, physically, there's not a capacity to move at this point in time. As a government, we are deeply engaged with our region. We've been helping the Pacific, we've been helping PNG, we've been helping Indonesia and others. We have taken responsibility to help with finance, with resources, with support, and at the same time, we are aware that there are some potentially huge challenges within our region if COVID-19 coronavirus gets out in some of those countries. That's where the people you have on the ground in those countries now, if you have skilled Rotarians, if you have other networks, then you can engage through them to have them prepared on the ground. You know, there's not an immediate foreseeable opportunity for Australians to travel there, but there is the capacity to, I'd say, activate the Rotary and related networks that you have on the ground. So that's our best answer, but it is important to know that the government has, even today, been focusing very strongly on the aid program and how we can assist with critical supplies and critical training.
Our next question, Minister, we did touch on the vaccine before, comes from Grant from Mount Eliza here in Victoria. Is it the government's plan that senior Australians will have first access to a vaccination once it is developed?
We actually haven't done a protocol yet because we think it's at least 12 months away. But I can imagine, as we do with the flu vaccine, that we would make seniors a priority. They are the most vulnerable, and I haven't had this formal discussion, so I think it's a fair point to be. It's important to be completely honest about this. But Grant's question, I think, does make perfect sense. We do that with the flu vaccine, and I would encourage as many people watching today as possible to get their flu vaccination, and we'll, I think, consider it when we get close to it, but I would imagine that is an overwhelmingly likely and very sensible proposition. Thank you.
Now, something very dear to all of our hearts, I'm sure, is sport. And Helen from Nelson Bay, beautiful Nelson Bay, New South Wales, she asks us, does the government have the power to tell the rugby league, the NRL, that it is unsafe for the game to go ahead as they wish? And you could extend that to the AFL as well.
Look, there are very, very clear powers here, and that they've currently been implemented largely under state law in relation to the gatherings, and the states would have to approve, so they would have to approve any activity which is outside the current guidelines unless the guidelines were to be changed. As I've said, we're planning that road out. PM today said, let's understand we have to be patient for a significant number of weeks because we're right at that deep containment phase. And once that's stabilised, then we can start to look at priority activities. So we're not opposed to people planning, but they won't be proceeding unless there is very clear approval from the authorities.
Minister, our next two questions I would like to bring together. One is from Sue from Yarram here in Gippsland in Victoria. The second from Val from Sydney, of course, in New South Wales. Sue's question is, could the Minister speak on which types of surfaces allow the virus to remain active and for how long it remains so? And Val's question, is there any cleaning of air conditioning ducts in buildings, planes and cruise ships? The spread of the coronavirus is occurring in enclosed confined spaces such as cruise ships, planes and buildings. Air conditioning ducts carry recycled air from people breathing.
Yeah, so both are very important questions. I might actually go to Val's on the nature of transmission. There are two different types of transmission. I suspect those with a medical background will be deeply aware of this in terms of airborne and droplet, or aerosol and droplet. And aerosol means if I sneeze and somebody is 3-4 meters away from me, or I cough, it will stay in the air. Measles is the most obvious example of that, highly, highly infective. And this is not an aerosol. And so it's not, to the best of our knowledge, and there's been extensive work on this, being transmitted through air conditioning. It's a perfectly reasonable and important question to ask, and it's one we've looked at, but there's now very strong evidence and science from around the world on that. The planes, we're not aware of any transmission in Australia at this stage. I think that was the advice from the Chief Medical Officer. It's not impossible, but the planes are keeping a good distance between people for the most part. And their air conditioning is such, the particular nature of their air conditioning is that it's the opposite of spreading. It draws it in, it draws air upwards and away from people. So it just means that any droplets that I had were less likely to land on somebody near me. Surfaces, however, can absolutely be contagious. Now, there is some debate as to whether it's half an hour or 2 hours, but obviously the smoother the surface, the more metallic, the higher likelihood. If it's a surface that is a cloth surface, then there's a vast reduction in the risk of that. The virus can, of course, live for a short period in food, and that's the presumption from the cruise ships, that often it has been spread through food handling from crew. So the Diamond Princess in Japan, which had such spread, it's likely on all of the early evidence that much of the spread came through the galleys or the kitchens, and contaminated or positive galley crew then passing it through the food or on the materials that they were giving up. All right, I think that's that.
Yep. So our next question comes from Ray from Traralgon in Gippsland. Contact tracing, which you spoke in your earlier message, with extensive testing appears to be one of the most important tools to allow restrictions to be withdrawn. How well are we going implementing this strategy here in Victoria and Australia-wide?
Yeah, so contact tracing means, let's say I'm diagnosed. The health authorities, the public health authorities, sometimes with the help of the police or others, would literally conduct an investigation. Who are the people I've been close to for more than 15 minutes? Have I passed, have I had physical contact with them? And trace back to 24 hours prior to my symptoms showing. That's what they're looking at, because people may not always be aware of symptoms. They can have very mild, so they trace back. Now, the contact tracing has been one of the critical things. Victoria has upscaled from a public health unit of a few dozen to 1,000 now, and that is going well. So I want to acknowledge and congratulate them on what they've done, along with other states. And we're assisting at the Commonwealth level with resources and with how this works, and that's a very, very important part of what we do going forwards.
Of the coronavirus is known to infect people, around half cause common respiratory infections, we're led to believe, that are sharply seasonal. As we move into our winter months, what advice, based on our knowledge of COVID-19, do you have for Australia? And can I also pick up one of our live questions from Richard? I'm not sure where Richard is from, but he notes here, is it still expected that 80% of people will eventually get the virus? If most of us will get it, should we work on our fitness, immune system, health in general?
Yeah. So firstly, to Richard's point, no, it's not expected. Had we seen 80% of Australians, that's 20 million Australians, and with a 1% fatality rate, that would be an unimaginable outcome. The thing now is, just looking at the figures I've been given literally before coming on air with you, 6,400 Australians and less than 2% daily growth rate. I think that speaks to how we're doing as a country. We have a very low rate of growth, and more than anything else, we've flattened the curve in a way that virtually nobody else has. There are a few which have gone from a peak as far down as us, but not many. So a lot more work to do. But therefore, for everybody, the best thing we can do is to keep a distance. You can have fit people who can have a respiratory problem, and so none of us are immune to coronavirus. It has very close relationship between age and comorbidities. The median age of those that have lost their battle has been 80, and this very simply, and it is a frightening figure, as you get older, there's a higher likelihood that if you do contract the disease, you'll get very serious complications or worse. Now, having said that, what was the other question? I apologise.
And so the other question was in terms of the COVID-19 being seasonal.
Oh, right. So seasonality. We don't know yet. There's not strong evidence of that, but we're preparing in case. And so that's why continuing with what we're doing is so important. We've got the scientists looking at it. Indeed, I spoke with the chief scientist, and we're getting additional advice. They're doing a review of all of the best science from around the world and providing the advice on that. But the early hypothesis is there's not a strong correlation at this time. Coronaviruses, as a family, are very common and known in humans. What this one has is high infectivity and high consequence. and that's what sets it apart. And with low natural immunity against it, if that exists at all, other than really in children.
So, Minister, the final area that I want to touch on is mental health, which has been an area of focus of yours and indeed the government's since you assumed your health portfolios some years ago. With Australians self-isolating and concern for their well-being, both in terms of their general health and financially, how are we looking to support those most vulnerable at this time? And I just want to pick up a question from Terry from Dandenong here in Victoria as well. The data collection has enabled daily updates and analysis has been good to see. He asked the question, will the methods used for this data collection be applied to other areas of health? And I am particularly interested, he states, in the area the government has flagged of suicide prevention, as I know how difficult it has been for the primary health networks getting access to data.
Yeah, look, thanks to Terry and to everybody for the questions today. Now, in terms of mental health, what we're doing is we've put in place two limbs to this. One is the comprehensive package around services, coronavirus.beyondblue.org.au, coronavirus.beyondblue.org.au, or Lifeline or Headspace and other services with the 74 million I mentioned earlier. But secondly, there are all of the human supports through funding for disability groups, for seniors, Meals on Wheels. So there's that continued human engagement. That's what I would call prevention rather than treatment. And the preventive side is extremely important, that human engagement. And this really brings me back to what Rotary can do. And Terry's question, with suicide prevention, we are very cautious about a running tally. The advice is that it's not a desirable thing, that it becomes a focus. And we also have to be cautious because the coroner does a thorough review, and sometimes those coronial reviews can take a very considerable time. Was something an accident? Was there something worse involved, or was it somebody taking their own life? And so there is a delay on that data, and there is a strong view from the mental health community that putting out a sort of an ongoing tally actually is not desirable. But what we are doing is focusing on clusters. So where there is an area like Grafton that some years ago, it was one of the first things I did in this role, had a youth cluster of suicides. Pat McGorry and I went there. We put in place a headspace. We put in place programs. And when last I heard, there hadn't been a young person that had taken their life in that area since Headspace came in. And so expanding that network, not just Headspace, but adult equivalents to Headspace, and focusing on clusters, because it's one of those areas where there can be the sadness of one loss leads to the contagion to others. And so we're really focused on that. Final thing is, many of you will have used telehealth. So you can now pick up the phone and call your doctor. At least a third of those calls generally, in terms of visiting the doctor, are for mental health. We don't have data yet, but I suspect it's likely to be higher on the anecdotal advice I've had from the RACGP, the College of General Practitioners and others. So that telehealth with well over 3.5 million calls is a huge lifeline of and in itself. And to those who are watching, please support others. To those who are watching, if you are feeling some of the signs of anxiety, depression, isolation, loneliness, it could not be more normal. It could not be more understandable in this situation. So reach out to your doctor, reach out to one of the services, reach out to one of your friends. And if Rotary can do one thing above all else now, the phone trees, calling each other, checking that people are okay. You won't just save lives through protecting against the coronavirus. You'll save lives by ensuring that people have the support they need. You know each other, and you're the ones who are most likely to pick up those early signs. So I want to thank everybody and say it's a privilege to be something of a poorly performing Rotarian. My record of attendance for my Hastings branch is a little bit disappointing. I apologise, but I've seen what that branch did in helping to create a national chaplaincy program and what Rotary has done, along with Peter Rawlings and so many others. And I've also seen what you can do now, and that is the phone trees, the reaching out, the support for others. You're a huge part of the glue that makes up the Australian family.
Thank you, Minister. And I just want to mention the Coronavirus Australia app. Your department's website, health.gov.au. Now we're going to send these out as a follow-up to this forum today, but it is an absolutely excellent first-class app. So I'd encourage each one of you to encourage those in your networks to download and access that. Do you have any final comments before we close up?
Like, this has probably been the most extraordinary time since the war. Some of the older Rotarians, as kids, will have lived through this. And my uncle, who's 85, was very young and lived through it. And he said to my kids the other day, it was my daughter's 15th birthday, and he rang up and he said, things will get better, and we're going to get through this. And I hadn't realised that the things will get better. I think, Peter, comes from an old Vera Lynn song, and that evening the Queen used the phrase, and I think harkened back to one of the wartime songs. And that is true. They will. We're just achieving these outcomes earlier than we'd hoped, on a better scale than we'd hoped. There's still a serious distance to travel, but I'm now more optimistic than ever, and what you've done as an organisation, what you've done as individuals, has been and will be a huge part of that Australian story. Thank you.
Thank you, Minister. And before I pass back to our District Governor to close, I'd just like to share a statement from Ted from Ku-ring-gai up in New South Wales. And I think this statement from Ted says it all. He says, I would ask that the thanks of all Australians be passed on to Minister Greg Hunt for the calm manner in which he has handled the enormous pressure that he has been under for so many weeks. And I'm certain that this has had a very positive effect on the way Australians are finally accepting the necessity for the regulations that have been put in place. And Ted is a 78-year-old community pharmacist in New South Wales. He's still operating his business, and we just thank people like Ted and all of those working across our hospital and health system.
Well, look, let me just finish by saying thanks, Ted. They're very generous comments, but the real heroes are our health workers, our doctors, our nurses, our pathologists, our allied health workers, and of course our pharmacists. And so to all our health workers, thank you from me. But if any of you are out there and you're seeing the nurses or doctors or pharmacists, just pass on your thanks. It will make a massive difference. Take care.
Thank you, Minister Hunt. And back to District Governor Adrian. Thank you.
Thank you, Peter. Never before or never have our current generations faced a year of such tumultuous events and change. Never have we been tested like this as our forebears were during the two world wars and the Great Depression. Never has there been such a need to put the community's collective welfare ahead of our own. So how are we doing? I think we're doing quite well, though sadly we still have some Australians putting self-interest first. To many of us, and especially Rotarians, service above self and service to our communities is core in our beliefs, and as such has made the transition to the restrictions a bit easier for us. It has been a tough year. Droughts, fires, floods, and now COVID-19. We have people still in sheds, old caravans, and even tents. their savings depleted, on their own as volunteers like us who would be supporting them are grounded. We have fire survivors whose mental health was compromised before COVID-19. Just imagine how it is for them now. Despite COVID-19, our collective Rotary relief efforts are continuing. In East Gippsland and in my district, we're still getting vouchers out to needy families. We're still purchasing, transporting and donating stock feed. We're still ordering and donating container loads of wire and fencing materials, and much more. Add to this the efforts by the other Australian Rotary districts, and there is no question Rotary has been quietly doing an extraordinary job. The Rotary Foundation, Rotary Australia and World Community Service and district governors are working together for the long-term fire recovery aid and the rehabilitation of many towns and districts. We are working on global grants from the Rotary Foundation, leveraging generous offers from our global Rotary colleagues and benefactors. With close to 100% of all funds raised distributed for relief efforts, Rotary is unique and I believe very special. We have a big role to play. The challenge before us all now is to swing our collective Rotary might in behind easing and assisting our communities through COVID-19 recovery, all the while continuing our efforts in the drought and fire affected areas. There will be much to do. But as Rotarians, we rise to challenges, and now will be no exception. Many districts and clubs have had to cancel events due to COVID-19, but let's not dwell on that. Let's be proud. Let's see what we've gained. I think we can be very proud of the way Rotary in Australia has and continues to step up in response to this wave of adverse events. Be proud of the way Rotary clubs and districts have adapted to using online media like this to continue our work. Well done, everyone. This webinar was the concept of President Peter Rawlings, who you saw tonight beside Minister Hunt. Thank you for that inspiration, Peter. Well done. I would also like to thank the following from District9820 for their input to planning and running tonight's webinar. District Governor-elect Mark Humphreys, Secretary Jane Moore, Zone 8 Regional Coordinator, past District Governor Tim Moore, Janet and Rob from the Public Image team. But the man I really want to acknowledge, and probably, I'm sure, in fact, one of the busiest men in Australia currently, is Federal Health Minister Hunt. Minister, thank you very much, not only for generously giving us your time, but also for sharing your wisdom, your insights, and your thoughts. We heard it before, the calm management and leadership you've provided to Australia's COVID-19 response is admirable. I would ask one thing of you though, Minister. Rotarians are people of action. Please let your colleagues and advisors know that Rotarians throughout the districts of Australia stand ready to assist in any way that we can. Just before I conclude entirely, there have been some questions came through that haven't been able to be answered in the Q&A. We will approach Minister Hunt and just see if we can still come up with some answers for some of those questions. There are some very good ones there. To those who asked if this event was being recorded, yes it is. We will be sending out the link to everybody who's participated, so people who are unable to join us will still have the opportunity to view this webinar. So just to wrap up, to all of you who have joined us today, thank you for your company and attention. We sincerely hope you've enjoyed this webinar and hope you'll join us again in the future. To the members of the public who have joined us tonight, we hope this event has showcased Rotary to you and we encourage you to explore a Rotary world of opportunity with your nearest club or district. Please stay safe, everyone. Good night.